One second. So listen, he has a distal M1 occlusion, okay? So we should activate the cath lab. What is your name? So we call this a distal M1 MCA segment occlusion. This carries a poor prognosis if it's untreated. He will receive intravenous TPA, but we're not waiting for TPA to work. So we're going in, and if there's persistent occlusion, we're going to try to open up with stent retrievers and aspiration.
My speech was not right. I mean, I could see the words, but I couldn't speak them.
The doctor came in and said that they were going to do the angiogram, and they had a new technique to go in and retrieve the clot.
When we perform these acute stroke interventions, it's a race against time. The faster you restore blood flow to the brain, the more brain you save, the higher the chance of a good outcome. We have not only one trial, but a slew of trials that confirm that there is overwhelming benefit for endovascular therapy in acute stroke. These results means that we are on the verge of a revolution in acute stroke care. What we do is we thread a catheter through the groin vessels, through the aorta, and from the carotid artery we go up to the brain and thread a small catheter into the clot. We go past the clot, and then once we're past the clot, we deploy this stent. The stent expands, creates a channel through the vessel, so there is immediate flow restoration, which is important. Most of the times engages the clot, so the clot kind of sticks to it. So we actually retrieve the stent. The stent has the clot attached to it, and the clot is removed from the vessel and flow is restored in the brain.
The medical staff, the doctors, were amazed at how quickly the symptoms began to subside.
Full name, please?
Joseph Catellis,
How old are you, sir?
66.
When we saw him the next morning, he was pretty much back to normal.
I was able to speak more normally within about a day and a half. I haven't had any weakness in my arms or legs.
He's like his normal self now. I'm extremely grateful that they've developed this. My choice is either not having him or having him, and so I'm just grateful for the medical knowledge to be able to save him and return him to normal life.
Finally, now we're able to offer these patients a treatment that really works. And it's not only that it works in a very strong way.